In today's video, we'll be talking about glaucoma and 7 things you did not know. Number one, what is glaucoma? Glaucoma is an eye condition in which there is a progressive damage of the nerve that connects the eyes to the brain. And this nerve, the name is optic nerve. Two, who does it affect? Glaucoma affects every age group: children, young adults, and elderly people. However, it affects the elderly people more. Also, if your mom or dad or sister or brother had lived with glaucoma, you have an increased risk of coming down with glaucoma. Number three, what are the causes of glaucoma? Generally, glaucoma has been linked to increased pressure in the eye, and this can be as a result of various causes: trauma, when there's maybe a punch or a hit to the eye. There can be tumors in the eye. There can be inflammation in the eye, or for some reason there's a fluid that is produced in the eye called the aqueous fluid. If that fluid begins to produce so much, or it is not draining as fast as it should, such a person can come down with glaucoma. Number four, how do you know that you possibly may be having glaucoma? What are the symptoms that it could present with? First, you must understand that some people may not have any symptom. Yeah, they may not have any symptom. Glaucoma is a progressive disease. It slowly occurs, and so in some people they may not have any symptoms, and in those who have symptoms, they may come down with red eyes, they can come down with eye pain. Also, they can have what we call the tunnel vision. They can just see the central part, but they cannot see the peripheries. Also, they can have blurred vision. They are not the sight is not as sharp as it ought to. When you see all the symptoms, there is a possibility that you may be dealing with one of the eye conditions, which glaucoma is also involved. Now, how can this be treated? When you notice any of the symptoms, the first thing you should do is to go to the hospital, see the eye doctor. He or she will do an eye check for you, which will include checking your blood pressure, the pressure in your eye, which we call the tonometry. He will do an ophthalmoscopy, which will check the optic nerve that connects the eye to the brain. Okay, he will do this, and including other basic investigations. And when a diagnosis of glaucoma has been made, there is treatment, and treatment will depend on the type. There is the normal pressure glaucoma, where even though we talk about the pressure being high rather in glaucoma, in some persons the pressure in the eye is actually normal, but they still have glaucoma. Okay, you can also have the open angle glaucoma. Here the pressure is high because the fluid produced is more than normal, as it were. And we have another type which we call the closed angle glaucoma. Here there is a drainage, a pathway through which this fluid is supposed to be drained, but if for any reason that drainage is blocked, we call that the closed angle glaucoma. And depending on this type that you have will determine the kind of treatment your doctor will give to you. They usually will give eye drops and ointments of different types depending on the kind of glaucoma that you have. Majority of this treatment help to reduce the pressure in the eyes, and reducing this pressure will reduce the damage to the optic nerve. However, if there is already damage to a part of the optic nerve, it cannot be reversed. That is why most times you hear that glaucoma cannot be the damage of glaucoma cannot be reversed, but there are some medications they can give you that can just manage the disease. And that thing your doctor may ask you to do is surgery also helps in large number of people, especially those who have closed angle glaucoma. What can go wrong if glaucoma isn't detected on time? You can have vision loss. You lose your vision, and in some severe cases it can lead to blindness, and so you must act fast when you notice any of these symptoms that I've earlier mentioned. How can you prevent this disease? Number one, you need to eat right. the right diets, add fruits and vegetables, all those fruits that contain vitamin C, vitamin B12, B carotene like carrots, tomatoes, green vegetables contain some things that are protective to the eyes. Also, if any of your family member is already living with glaucoma, you must have a regular eye check. At least every 6 months you should go and see your ophthalmologist for them to check your eyes, and for the general public at least once a year. We've talked about 7 things that you did not know about glaucoma. If you enjoyed this video, hit the like button, on the subscribe notification so that you will be the first to know about my videos when they come up.